Welcome to On the Beat. Gastroenterology Associates in Columbus and Starkville are here with us today. I am sitting with Dr. Ricky Johnston and Dr. William Gillespie. And it is a new year, and typically with new years come new recommendations and possibly new treatments.
Yes.
So what's new for our viewers to know about?
Well, we figured there'd be a few things that we could talk about that's been new kind of in the GI world in the past year. I think one of the things that people probably have seen on commercials is a lot of these treatments for inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. And the evolution of that's been, monumental in the last 10 to 20 years. When I was in training, we really didn't have great treatments, and that's progressed. We had some IV treatments and some injectables. And now in the last year or two, there's some oral treatments. Rinvoq is one people have seen commercials for. It's very effective, and it's allowing people to avoid having to get infusions or IV injections or inject themselves. So it's been very helpful.
And also, too, if we look at colon screenings, any recommendations for the new year with colon screenings?
Well, more recently, they've reduced the age from 50 to 45 for the general population, so everybody is due at age 45 rather than 50 now. And that's mainly because a lot of younger people were getting colon cancer. We don't necessarily know why. We think maybe it has something to do with diet or environment, but we're still not sure. But we did know a lot of younger people were getting colon cancer, so now we screen at 45.
And also, too, we were talking before we started recording about liver disease and the recommendations for screening on liver disease.
Right, so hepatitis C is a virus that we've been treating for a long time, but it can cause cirrhosis of the liver and has some detrimental effects. And so, again, like inflammatory bowel disease, initially we didn't have great treatments for that. When I first got out of training, you had to give yourself an injection once a week for a year, and your cure rates were 50% at best, and it made you feel like misery, like you had the flu. And so that's evolved too, and now we've got all oral treatments for that with really high cure rates, 95% or better.
That's amazing.
Yeah, it's really impressive. And so, and the recommendations for that, we used to just screen people who had risk factors, IV drug use or transfusions prior to 1982, some other things. But now every adult needs to be screened at least one time and it's a simple blood test that their primary care provider can run. And if it comes back positive, they could be referred to us for evaluation.
Good to know. And also, too, what would you say is new with your practice?
So we're evolving. We've added a nurse practitioner or two in the last year. We continue to operate a clinic in Starkville. Our home base is Columbus, but we have a clinic in Starkville. And we frequently get asked about being able to have procedures done in Starkville, and we're working on that. We've identified a location, and ultimately we'd like to build an endoscopy center over there at some point. So hopefully that'll be coming down the road.
That's great news.
Yeah, I think. And one other trend that we've seen in the GI world, and not really just GI, but a lot of medical practices have sold out to corporations or private equity groups. But I think it's important for people to know that we're still privately owned, or we're owned by ourselves. We're a private group and locally based and independent practice.
And what would you say is the most common question you get from patients?
Maybe about screening, like when do I need a colonoscopy? Why should I have one? I think colon cancer awareness is coming up in March, and we may devote a whole segment on that here shortly, but that's one of the topics we get. Oh, you talked about liver disease. I think one other thing we'd like to talk about is fatty liver. We've got treatments for that. We can do fiber scans in our office. So if you got fatty liver disease, that'd be something we could help you with too.
So lots of great news for the new year, and thank you both so much for being here. And look at your screen and you'll be able to get information about how to contact the doctors, and also be sure to go to their website to learn more about their practice.